Hey everybody, so I want to do a little short video. Today I want to talk about Lyme disease. So recently, if you watched my previous videos, I've talked a lot on the channel about mold toxicity, and we've talked a whole lot about multiple chemical sensitivity. And I want to go into a few stories about Lyme disease and my recent diagnosis. They found 3 different types of Lyme bacteria, and the test that I used was a Lyme panel test that my mast cell doctor ordered, which is from DNA Connections. And it's in the US, it's a Lyme panel you can order without a doctor having to write you a prescription. Now, I think in Europe, you had to have a prescription to or a referral to have the test complete. If you've watched my previous videos, I was doing a lot of binders, you know, Barbarella, was doing the EDTA. I had to back off on all that stuff. I haven't really been doing a whole lot of detox the last 2.5, 3 weeks. It was a little much with the Lyme medicine. I get questions and I get comments about, you know, the protocols and stuff, and of course every Lyme doctor is going to vary, and you know, there's going to be some variations in it. But from my understanding of my physicians and my doctors, is if you have an acute infection, if it's a recent infection of Lyme disease or Barbarella, or I think Barbarella is the most serious one, which I also have. And it's a wide array of symptoms, from air hunger to fatigue to, you know, it's even known to set off MCS and mold toxicity. Or if you're exposed to heavy chemicals or metals, you know, these type of infections can flare up, because every co-infection and every virus that you've ever had, it stays in your body. So when your organs and stuff's weak, these infections, you know, they flare up and they show themselves. That's the reason why you see, when you go to a nursing home or old folks home, you know, they get bladder infections. You know, your body's constantly fighting off infections and viruses and bacteria and mold, and it's only when your body's in a weak or damaged state that these infections kind of flare up. And when I got heavy metal and chemical poisoning, I guess my Lyme flared up. So the first thing I want to go into is, in 2017, I had uncontrollable body movements. And with these uncontrollable body movements, you know, I have spasms, and my shoulder would move, my head move a certain way, you know, I couldn't sleep at night, insomnia, forgetfulness, you know, cognitive issues. And I was having nosebleeds, and this was before my MCS had started. They'd swab my nose and my ENT, and they found MRSA and staph, and it's pretty serious when you have overgrowth of it. And he put me on doxycycline, which at the time I didn't know that doxycycline also treats Lyme disease. It's one of the go-to antibiotics for Lyme. And after he done the 11 weeks attempt to clear up the MRSA and the staph, my muscle jerks and my muscle movements, or involuntary muscle movements, had stopped. So I never contributed to Lyme disease. So I guess it put it kind of state of remission. But around that time, I had just went to work for a local manufacturer, and I was exposed to a lot of heavy metals and chemicals, and over time, you know, in my previous videos I mentioned before, you know, I started losing my hair, facial swelling, fluid retention, severe coughing up blood. And then I developed the sensitivities to smells, perfumes, fragrance, all that stuff, typical MCS type symptoms. And then outdoor sensitivities came along with it. Even though I had allergies, it was under control. So it just, everything intensified, you know, 100 times. But so I had the Western blot done, which is the standard Lyme test, and it came back negative, and I believe it was the S. I don't remember the other test that came back negative, but a lot of people don't know that the Western blot, from my understanding, only checks for one strain, and number two is the strain that it checks for is not even in Virginia and a lot of other states. The other odd part that a lot of Lyme doctors and a lot of specialists missed is the spirochetes from the Lyme bacteria goes into hiding sometimes minutes after infection. Some people comment and they'll say, you know, I don't remember a tick bite, but if, let's just say you got bit by a mosquito and that mosquito had bit a deer, or let's say another person, and they had Lyme disease, let's say you got Lyme disease that way. So, you know, these things can kind of hide in your body for years and years and years, and you know, they you don't even know about it. And then when you're exposed to mold or heavy metals, these infections flare up and your organs just can't take it. And then all of a sudden you have all these problems. You got chronic fatigue, and you got, you know, you got vision issues, and you got a fragrance allergy. And so that's why I'm really big on the channel about treating, you know, everything, you know, investigate everything, keep an open mind. So let's fast forward to recently, what's happened and what's went on. So in November, I'd seen my mast cell activation syndrome doctor. He's absolutely fantastic, absolutely great doctor. His name's Louis Matos. He's located in Virginia, and he'd recommended a full Lyme panel, which checks, I believe, for 8 different strains of Lyme bacteria, and it's by DNA Connections. It's roughly a $600 test. I did the test thanks to GoFundMe, and I came back positive for 3 different types. Now, what is the treatment? A lot of people, you know, the go-to is antibiotics. But since this is a chronic case, you know, a long-term case, and I've been on, you know, early on when my MCS started, before I knew I had MCS, I was on loads of antibiotics long before I knew anything about mast cell activation syndrome, or, you know, I went to the typical specialist and they loaded me down with steroids and all this other stuff, and I wasn't getting any better. And it's not the fix, it's not the answer. So my environmental doctor and my mast cell doctor, what they put me on is, this is known to work on long haul COVID, and it's also known to work on chronic Lyme infections. Ivermectin, I'll cover the bottle up. I started it roughly about 7-8 weeks ago. Had some die-off symptoms. Wasn't too awfully rough. I still was doing chelation at the time, so I was having some, you know, liver swelling, you know, kind of, I guess you would say, well, it was actually pretty severe liver swelling, because these things are hard on your liver. It's not so much the medication, it's the Lyme die-off. It's a Herxheimer reaction. You know, your feet can swell, you can have, you know, it's aggravating that Lyme bacteria. And so that's, you know, that's part of it. But there's a Patrick Plum on YouTube. You can follow his story. He had chronic Lyme disease, and he's got a lot of informative videos. I haven't got to check a lot of those out, but he goes into his journey from start to finish. But the medicine that Dr. Matos put me on, and I believe that it is working, because I have stages where my sensitivity is not that bad, and I have stages to where the day after, or the 2 days or 3 days after, when I'm having the Herxheimer reaction, my sensitivities are way up. And, you know, increased heart rate, a few symptoms, but he said to expect that. So what they put me on is a medication called anti-abuse. And a lot of people don't know this, but anti-abuse was used in clinical trials back, I believe it was in the 60s, 70s, and 80s for long-term alcoholics. It also, it works as kind of like it penetrates the blood-brain barrier, and what it does is decreases neurotoxicity. So it works for chronic alcoholism. But what they didn't know when there was a specialist that tested 250 types of medications for Lyme disease, and one of the medications that he had used or that he experimented with, along with all the antibiotics and the ivermectin and et cetera, in the clinical trials that he done, he'd found that anti-abuse was very effective at killing the Barbarella bacteria and the other types of Lyme bacteria. The reason why it works, they're not sure. So the typical usage is for chronic alcoholic, even though I'm not a chronic alcoholic. But it works really well to kill Lyme bacteria. They just don't understand why. Kind of like how the ivermectin is known to help long haul COVID. It's also known as like an anti-cancer drug, but it's not accepted by, you know, the ivermectin is not accepted by most mainstream medical doctors, and it's a shame it's missed. But I've heard of other homeopathic Lyme doctors and different ones. They use different types of herbal medications, and I've even heard of acupuncture, which I don't know if I believe that or not. But I do know so far the anti-abuse, I've had days where my sensitivities is not near as bad. I've had some pretty strong Herxheimer reactions, and if you suspect that, hey, you know, I think that my MCS, it might have been caused by Lyme, and, you know, I think it's worth looking into is, you know, if your MCS is so bad, your quality of life is terrible, and you're not working, and, you know, it's overwhelming. If it's not a mild case, if it's a severe case, like with myself, I believe that it's worth looking into having that test done, and that will answer whether you have it or not. And the interesting part that I learned from my mast cell doctor is when you start these medications like anti-abuse, it can kind of stir up that Lyme bacteria, and you can retest for the Western blot. Sometimes it'll show positive, and that way it will confirm exactly whether maybe Lyme or Lyme bacteria is causing your MCS. There's a lady that you can look up. She's called, I don't remember her name, but it's Hells, Bells, and Mast Cells. It's a Facebook group that there was a lady that pretty much cured her multiple chemical sensitivity and her mast cell activation syndrome from treating Lyme disease. There was a few others that also cured their mold toxicity and multiple chemical sensitivity from treating Lyme. Now, I don't know what medications they used or protocols. The only thing I know is I'm on 2 medications for that. My food tolerances has went up. My tolerance for antihistamines has went down. I think that's kind of a good sign, because I was taking about 4 Claritins a day. Now I'm only taking about 2. I've had some things that's not bothering me near as bad, but I do still have my days that my sensitivity's up. I have my days, you know, I have weakness, and I have days where I have improvements. But definitely a big hats off to Dr. Matos for recommending that test. I think it's worth looking into. So always do your research. keep looking for that right doctor, because believe me, I went through, you know, my muscle spasms and stuff was so bad that it looked like someone with Parkinson's. And, you know, I kept getting told, you know, this is, you're fine, you're normal. It don't seem like you got MS or anything like that. I know something was off. So anyway, look up those medications. Talk to your mast cell specialist if you don't already have one. If you're seeing a standard allergist, most of the time they're not going to understand, they're not going to get it, they're not going to be able to handle these type things if you have severe MCS. Let's see, I did have one ENT that did know a little bit about multiple chemical sensitivity. But I think it's for another video that I would like to go over that. So hopefully that helps answer some questions. Just remember antibiotics for the acute infections or recent infections, and remember the antabuse and ivermectin and some other herbals, or they call them homeopathic, which I assume is non-traditional medications or treatments for the chronic Lymes. But some people go in remission, some people battle it for years. The goal is, after taking the medication, to do the Lyme panel again, and if the bacteria doesn't show up, then that's great. Now, so I'm going to wrap it up. Y'all have a good one. I want to talk a little bit about that.